do our very best to make an abnormal situation as normal as possible and have a wonderful experience, at least the best we can for our students and faculty and staff, and also most importantly, ensuring the health and safety and well-being of everyone as we move forward. And I'd like to recognize, so you know that they're on the call, as we have questions in just a moment. Provost Tim Todd is on the call, so he'll be able to answer questions as well. Vice President Dr. Don Robertson, Vice President Jackie Dudley, Jordan Smith, who is our Racer Safe and Healthy Officer and has handled a lot of the work that we're going to talk about today, our General Counsel Rob Miller, Joyce Gordon, our Director of HR, and some of her staff members, Sean Tooney, our deans, chairs, and many others. And I want to thank those individuals, especially for the last, really for the last several months. They have spent an inordinate amount of time working on the Racer Restart Plan. And about 200 of our faculty, staff, students, administrators, healthcare professionals have worked very hard in regard to establishing this plan that I'm going to reference again in just a moment. Also, some of our regents are on the call today. Talked to Chair Rhodes recently, Vice Chair Eric Krigler this morning, Dr. Melanie Schimberger, Mr. Phil Schooley especially. Student Regent Warren Norman may be on the call as well. I want to point them out because they're here. 3 of them are here regularly and here on the campus each and every day. And they've been very involved in all the things that we'll be talking about today. Also, I want to thank Dr. Bob Hughes and Marky Burkeen, the staff with Murray State University Health Services Office and Primary Care Medical Center, as well as our Callaway County Health Department. They've been intimately involved in this process. They've done an excellent job in advising and helping the university move forward. And I really want to thank those individuals as well. As you all know, move-in of our students started, for our traditional students, started this morning. Some of our students started moving on campus literally 3 or 4 weeks ago. And so we've been working through that. I had a chance this late morning to spend a couple of hours on campus in several of our different residential colleges, and the Curris Center and Winslow, visiting with families and students and parents, and a very good experience. They're excited to be back, and they're all adhering to the protocols that have been put in place, and I appreciate that, and I know we appreciate that as well. Today, I know there will be several questions. All questions will be answered. They may not be answered in this particular meeting today, just for the sake of time, but they will be answered back to. This is, we've been holding many meetings for the last several weeks like this with different groups. And so again, if you have a question, use your chat function to send a question. Jennifer Klein is the moderator. She will be handling those particular questions, whether they're directed to Dr. Bob Hughes or the provost or me or someone else on this particular call who can answer that question. There's someone here who will be able to answer it, of course. Stay muted, if you will, to stop background noise for everyone else. So please stay muted and use the chat function for questions. I would like to lastly touch on the Racer Restart Plan, and I want to ask everyone a favor. So over the next day or 2 or 3, if you haven't already, reference the Murray State University website in the Racer Restart Plan. So it's murraystate.edu/Racer Restart. I get questions by email, text, or calls nearly every day, and I know that most of the administrators at the university are getting lots of questions as well. I've learned that about 95% of the questions we're getting are answered on that website in some way. And if it doesn't, please send it. There's a detailed PDF that you can look through. There's a searchable function. There's all kinds of information that will reference most of the items we're going to talk about today. There are videos about the good protocol that has been put in place in regard to the Racer Restart Plan. So once you get an opportunity this week, if you haven't already, please review that website, and I think it will help you as we move forward, and encourage your colleagues, fellow students, fellow staff members, departments on the academic side. Please encourage everyone to review the Racer Restart Plan. Also, I referenced the videos. Please watch them, use them in whatever setting you deem appropriate. I even had a question this morning, are masks required? Yes, they're required by the Commonwealth of Kentucky by executive order, and they're required on this campus for faculty, staff, and students. And so we'll be talking about that, I'm sure, in the days to come. So, and it's mostly probably students from other states are asking the question more than anyone else, but masks are required. That's for me to protect you and you to protect me. And so we can all protect each other and this particular campus. There's a return to campus questionnaire. If you haven't completed it, you need to complete it ASAP. That's important because we're watching that information very closely as we go through the testing process that may be needed for any faculty, staff, student as well. So go to your MyGate account and find the return to campus questionnaire so we can get that completed and you get that submitted in order that it can be reviewed as soon as possible. Also, as an FYI, especially for the students that are listening today and participating, the governor of the Commonwealth of Kentucky, Governor Andy Beshear, has put in place an executive order in regard to social gatherings, and it's 10 or less. And so an executive order, many of you know my background. I worked in government for several years. An executive order has the power of law, so please adhere to that and the executive order in regard to masks. Those are two very important ones that I want to make sure we stress as it relates to social events. So we'll be monitoring those type things very closely as well. As you look at the Racer Restart website, there's a number of things that we all need to do to protect each other and to have a good fall experience. On top of the list is make good choices. And that's especially for our students as it relates to having the best possible semester that we can possibly have in the environment we're in. Is make good choices. And yes, we understand masks, we understand social distancing, we understand all the other things that you'll find that are required in our plans that you'll find on the website that I'm sure we'll talk about this afternoon, but making good choices. And lastly, our Murray State University Health Services operation will be geared up and ready for use by faculty, staff, and students. And I'm sure we'll talk about that in a few moments as well. I'm going to stop there. I'm sure there's going to be several questions and that have already probably come in, and we'll answer each and every one of them. If we don't get to it again on this particular call, this meeting that we're having, we'll get an answer back to you as quickly as we possibly can. Thank you again for participating. It's good to see everyone. You're very small on my screen, but some of you I haven't seen in some time, Dr. Bob Long, and I hope you're doing well, and many others out there I could point out, but it's good to see everyone. Jen, you're muted. We'll turn it to you.
Sounds good. Thank you so much. We do have some questions coming in here. So as Dr. Jackson said, bear with us as we go through some of these, and any of the ones that we don't answer out loud here on the Zoom, we will provide answers to afterwards. A couple questions we've gotten so far, Dr. Jackson, are about the maximum 10-person meeting requirement when we're meeting in social settings, and how is that going to be monitored, or what types of protocols need to be gone through in order for student clubs, organizations, groups, those type of those type of groups to get together for that 10-person maximum, and what needs to be done to make sure that they are, you know, monitoring and making sure that we're reaching those limits.
Right. So let's talk about on-campus events and off-campus events. On-campus events that are sanctioned and are part of the university setting will be handled very differently from the standpoint of social distancing, requiring masks. Every space, place, classroom, location on this campus, indoor and out, has been managed this summer in regard to capacity. And so we know what the capacity is. And Dr. Robertson's area, as they're booking, whether it's a fraternity or sorority meeting or whether it's some other type of event, can manage and help in regard to what is the capacity. And the capacity is going to be very small in all cases. The external events, when we start talking about 10 or less, these are non-university sanctioned events. So, you know, having parties at different places on campus, you know, use good judgment, make good decisions, make good choices in order that we have a good semester and make sure we manage numbers in those particular areas.
Great. And Dr. Hughes, this might actually be a question that you might want to chime in on as well. We've had a couple questions come through about the reasoning behind not having everyone being tested prior to coming back to campus, both faculty, students, and staff, if you could speak to that.
Yeah, I'd be happy to. First off, if you see me talking, at times it looks like I may be talking to myself. So it's not a undiagnosed mental illness. I've actually got Marky, the practice administrator, sitting to my left here. So if you saw me talking, I was talking to Marky. But no, to that point, I think if you look at a lot of different universities, there's a lot of different ways to do this, whether you test everybody that comes back or you don't test anybody that comes back, or you have some hybrid of such. But the problem with testing everybody when they come back, it's only good at best for that day and maybe not even that day itself. For instance, usually if you're exposed to the coronavirus, you will not test positive till 3 to 5 days after that exposure. So if you were within that window, you could be tested and essentially be negative, but be infective and probably even spreading the virus. So there's no utility in doing that because it doesn't answer a lot of questions. But anyone that needs to be tested, and this seems to be the trend that we're seeing nationally, is to pull back from just willy-nilly testing, but rather do it on a more focused basis for people that, one, have either been exposed, two, have a reason, a high index or even a low index of suspicion they could be clinically infected with the virus itself. So that was the reason that we didn't see any utility in doing it.
Great. And we had another question come up about how the reporting will be done regarding positive cases on campus. And I know a lot of this information, as Dr. Jackson mentioned earlier, is information that is on the murraystate.edu/racerrestart website, but it might be important to reinforce some of these thoughts and ideas here on the Zoom call as well. So if you could speak a little bit to how those cases will be reported, and will that be something that is shared out campus-wide or just shared out specifically with the groups of people that it might affect directly?
Sure.
Yeah. Well, do you want me to answer, Bob, or President Jackson, or you want me to?
Let me say this first, Dr. Hughes, before you answer that, is today, again, I want to encourage everyone to go to the Racer Restart website, okay? So you'll hear me say this several times. There's a link on the left-hand side, and it says testing protocol or something like that, testing, tracing. We've been working very closely with the state, regional, local health departments, CDC information, et cetera. So there's privacy rules that we have to adhere to in regard to this, but also there's a very specific protocol of how we will handle this, again, for the health, safety, and well-being of the campus. And yes, there will be a notification process. Dr. Hughes can speak to it, and also Jordan Smith may want to speak to what's been posted and how that's been updated and what we'll be doing in the next few days in regard to notification and they'll come really from two sources on campus.
Yeah, let me say something about that. There's two things. One is safety. Safety is paramount. And then the second thing is the confidentiality and the privacy of that medical information. So the notification will come from myself or the person that's working in student health directly to the person that was tested. And anyone over the age of 18 obviously is an adult, and that's protected information that goes specifically to them. Then the greater public health concern then is handled by the health department, and we're required by law to report those to the health department. And then from that point, it's their responsibility to come back and start the contact tracing. You know, should there be something happen or a shortfall in that, obviously, again, we could modify what we do in the interest of safety. But that's the way it's starting out, is with us notifying the patient and then notifying the health department.
So in regard to that, if someone tests positive, let's talk about students first. That information will go to the health department. The health department will then contact Dr. Robertson. And then a process called contact tracing will begin. And again, you'll find that on the Racer Restart website, what contact tracing means. And then Dr. Robertson will make sure that the academic side of the house is notified in regard to, you know, faculty, deans, chairs, the cleaning protocol goes into place, etc. So there's that whole side is covered from a student standpoint. In regard to faculty and staff, the health department will call Joyce Gordon, and then Joyce will notify again in regard to if it's a faculty member or a staff member, that respective department or that respective chair or dean, or to make sure it's properly handled from all respects. So yes, there will be a notification process. It's notified both from the student side, so it's kind of divided. If you go to the website again and look at the protocol, it's divided to students, and then it's divided to faculty and staff. And Joyce and Don, Dr. Robertson, and Joyce and HR will be the points of really decision making from the health department. The health department from Frankfurt will be handling all contact tracing. So that's that's the requirement that the governor and Dr. Stephen Stack, our chief public health officer in Kentucky, have put in place.
And as Dr. Jackson mentioned, on the Racer Restart website under testing, quarantine policy, and contact tracing, we have updated guidance that's been posted today on that.
Okay, thank you very much. We obviously have a lot of commuter students that are coming to campus as well that may not live directly on campus, as well as our regional campuses in Paducah, Madisonville, Henderson, our other areas. Can you speak a little bit to how students will be able to access internet, Zoom functionality throughout campus when they're going in between having an in-person class, potentially then going to either hybrid or online class, and will there be areas on campus for them to access those types of services so that they don't have to necessarily go back to their home or their residence hall or wherever they might be residing?
Sure, a very good question, and I'm going to say this at a very high level, and Provost, maybe you can speak to this, because I know we have all summer spent time identifying, again, places and spaces and locations on campus, rooms, classrooms, Waterfield Library, et cetera, where Wi-Fi is very good and students can use those particular locations. I know that there are some what are being tagged as Zoom rooms, and those will be identified more fully, and I think maybe in the next few seconds, but in the days ahead as well. And Provost, you may want to speak to that more specifically.
Yes, sir, President Jackson. Here in the Provost's office, Ashley Ireland has been running point on some of that, working closely with Jason Youngblood and facilities. Several areas have already been identified, several large areas, some rooms in the Carr Hall, Racer Arena, for example. In addition to that, several of the deans are working on identifying some of the classrooms they have, which are, when they are not in session, to have them open for obviously social distancing, but for students to be able to just sit down, to take a rest, to still have internet connectivity. So there should not be any reason for students to have to go back to their automobiles in a parking lot. I think we've got all of that covered. We've just got to communicate that to the students as we get them all back.
Great. Okay, so the Racer Safe and Healthy Kits. We have been getting several questions about this. And now that students are actually coming back onto campus starting today, can we talk a little bit about how students will access those Racer Safe and Healthy Kits, and specifically if that is a commuter student that might be coming to campus as well, and how would they access those kits once they get here?
I assume we're talking about the 12 guidelines that are being put in place. I hate to sound like a broken record, but I'm sure I'll say this several times throughout this call, is that website has all of that information. So there are guidelines that we're going to ask everyone to do, each day. Take your temperature. If you're sick, stay home. The questions go on and on. The 12 Racer Safe and Healthy guidelines that we've tagged them. Make sure we're adhering to those. We will also be sending out periodic questions questionnaires out to everyone to complete as well. So there's several mechanisms that have been put in place. Literally hundreds of hours, collectively thousands of hours have been put in place by a whole bunch of people, really from about May 1 forward, including today, in regard to making sure that we have all the proper protocols in place, looking at the CDC guidance, working with the state health department, our local health department, and other professionals, and especially Dr. Hughes and his staff in regard to Murray State University Health Services. So a lot of time and energy have been placed into this in order that we're making the right decisions, and all of this is being handled. So I would direct you there in regard to the guidelines to make sure we're doing those things, i.e. you're getting a Racer Safe and Healthy kit, and there's a thermometer in it, and take your temperature each day. And if you have a temperature, stay home. Don't go to class. Don't come to work. It's doing those type things, and making sure we're adhering to those guidelines, as we move forward to keep the campus safe and healthy. And Jordan, you may want to, so the return to campus questionnaire, we will be doing those periodically over the next few weeks and months as well.
And Dr. Jackson, I think the question also was about the kit. How will they pick those up, particularly if they're commuter students?
Great.
Correct.
So what is the process for picking up the kit?
So the process for picking up the Racer Safe and Healthy kit is when students go to get their new or updated student ID. That's when they will get their Racer Safe and Healthy kit. Also, the regional campus students will be getting them at their regional campus locations. But I will say that if any student has not received it and wants theirs, they can email me at msu.racersafeandhealthy@murraystate.edu. And again, that email is all over our plan. It's on the website, and myself and Procurement Director Beth Ward will make sure that student gets their Racer Safe and Healthy kit. But they are picking them up when they get their student ID.
And I think, Jennifer, the students in the residence halls will pick theirs up when they check in.
And Jordan, one other question along those same lines. If there's an office on campus that has not received their Racer Safe and Healthy kits yet, should they also email that email directly?
Yeah, they can email the Racer Safe and Healthy email account, or they can email Beth Ward directly as well in procurement.
Perfect. Okay. Let's talk a little bit about what is being offered at health services once students come back to campus, as well as for staff and faculty too. And Dr. Hughes, this might be something you might want to touch on. If we can just elaborate a little bit about what services are being offered, both from a medical standpoint, as well as counseling services. We've had some questions about that come through, both from a staff and faculty standpoint and student standpoint. So maybe we could just talk a little bit about what those offerings are for people.
Okay. The student health is it's a primary care office. It's an extension of the big office we have here in town. So figure any routine primary care illness that you would see your regular doctor for if you were at home, or whomever that may be, would be the same services. And of course that runs the whole gamut of illnesses. Now, there'll be limited diagnostics there, but if someone needs advanced diagnostics, let's say a CT scan, MRI or advanced lab, then they would get preferential routing over here at the office to get that done too. And it would be one in the same record, which would be synonymous with that record at Murray State. It's on the same computer system. With regards to counseling, then that would be arranged through the practitioner there with the counseling center at Murray State. So if you could look at student health, it's like a primary care office staffed either by myself or an advanced nurse practitioner that would be providing routine primary care, backed up by the 8 doctors here and the other practitioners and staff here. And then the hours there will start out on a limited basis to see what the need's going to be, which will be 4 hours per day. But then again, if that requires 8 hours per day, then we'll staff it 8 hours per day, Monday through Friday. And then past that time, then it runs 12 hours here. And then on Saturday and Sunday, it runs 10 hours each of those 2 days. So it's almost like one and the same there and here. It's just where the person chooses to go, whether they go to the student health center or they come here, the service will be provided.
Dr. Robertson, you may want to talk about counseling for just a second. And then Dr. Hughes, one last thing in regard to testing, COVID testing. You'll be able to do that in your office. You've been doing it in your office as needed. So I think it's important for everyone to know that as well.
Yeah, I could talk a little bit about the testing. The testing right now in Kentucky, the governor entered into a contract several months ago with a company up in Covington called Gravity. And those tests have been performed free in Kentucky as we speak today. But it's my understanding, again, these things change rapidly. They will continue to be offered as such up until the end of August. And then after that point in time, then it's a clinical decision, obviously, every time we do the test, who to test and for what reason. Then there'll be a fee on that. And the one that has the quickest turnaround that we found is Gravity, which is 18 to 36 hours. And at the most, I've seen it run 2 days versus some of the others and some of these national negative stories you may hear on certain companies being a week, 5 days, 6 days, ever how long it may take. And then the other thing is that we've been working diligently to try to get a rapid test to where we would have something within 5 to 15 minutes. But unfortunately, it's my understanding that the federal government has sort of taken control of those, the equipment to do that, which the first one that came out was Abbott Labs, and they've moved it into the more hotter zones that have like a higher positivity rate than we have here in Kentucky. So we're on the list to get one, but when that'll show up, hopefully tomorrow, but it could be a month or so. It just depends on, people's behaviors and the virus itself.
Jennifer, in terms of student counseling services, there's actually 3 options on campus. There's the Counseling Center, which is in Applied Science, which is directed by Dr. Angie Trespass. There's also the Psychological Center, which is on the 4th floor of Wells Hall. And then there's also counseling services in Alexander Hall. So there's 3 options. And this year, thanks to the provost office, on every syllabus, faculty syllabus is going to have information about those counseling services and their locations and hours of operation. So it is really important that students realize there are a lot of resources available to assist them, and we want them to take advantage of those services. And I think Ms. Gordon can talk a little bit about, if she would, the services that are available for faculty and staff.
Certainly, Dr. Robertson. We've got two different options that faculty and staff can use. One that we've been promoting and is being utilized during this time is we have free services through our employee assistance program. There are 6 counseling sessions that are at no cost to the individual. They can be in person with a local provider, or they can be telephonic during this time. That's for not only the employee, but anyone in that employee's family. Anybody in that household has access to that, and that's true for children as well. Also, we have just our regular coverage with through the Anthem insurance plan that faculty and staff can go. There's obviously a copay and that sort of thing with that, but a lot of times people will do the 6 free counseling sessions and then will sort of transition then into just the copay type of situation. Okay.
Okay. Let's talk a little bit about mask wearing. I know that from a university standpoint, we have put out a lot of information about that. And I know we actually have a video, Dr. Jackson, that you might want me to play from Dr. Stack that's speaking of mask wearing as well. But we've had some questions come up about if a student, well, when students and faculty are in the classrooms. Obviously, these classrooms have been properly socially distanced now, as well as every area on campus, whether you're in dining halls, whether you're picking up your eraser, safe and healthy kit, whatever that situation might be. Can you talk to the mask wearing within classrooms and within different rooms on campus? If they are socially distanced, do they continue to wear the masks, whether that's from a faculty giving instruction to a class that day, or whether it's students, sitting in class, attending the class?
An excellent question. I mean, the guidance, while not always consistent on this topic, each faculty member is going to have the language that Provost Todd has sent to put in syllabi of all courses in regard to mask wearing. It's become a part of our student handbook in regard to wearing masks. When you're in classrooms and indoors, you should wear a mask. There may be faculty members that say that's not necessary, but we encourage that. We want you to. Dr. Hughes may be able to speak to the medical benefits in regard to that, even if you're socially distant. A lot of the guidance says you should wear your mask indoors in the classroom as well. So if you're out in the quad, you're by yourself, and you take your mask off, that's one thing. But if you're with others, you should be practicing social distancing as well as wearing your mask. And again, in the Commonwealth of Kentucky, the governor has issued an executive order on this topic as well. So it's not only Murray State's policy; it's the Commonwealth of Kentucky's. Dr. Hughes, you want to say anything about benefit of mask? And we have a video. We can play that too, Jennifer, after Dr. Hughes.
Yeah. I would say just a few things about the mask. I think the evidence on that's just indisputable. I mean, unfortunately, it's got wrapped up in a lot of other stuff. But anything that you can do to reduce the spread of virus or contract that, even though the mask is primarily to protect the other person as opposed to yourself. But if you've got 2 people wearing a mask facing each other, then the risk is much, much lower. Now, the question had come up with regards to some audibly impaired people, maybe, whether it be students, if they can't hear, and that faculty member is, and again, Provost Todd could speak more to this, but because this is your all's rules, but if he's, quite a distance away and to project his voice and he doesn't have other methodologies, then, as long as that's 6 feet, and obviously 10 feet's better than 6 feet, the further the better. And so that he can be heard is very important. And then, with regards to a student asking a question, they need to speak through that mask preferably, but if they're distance apart and they can quickly pull that back and ask a question if they absolutely have to. You know, some of this, again, it gets down to making the right decision at that moment for everybody. What's the safest thing to do? Which route do you go, right or left on that one? So, but again, the mask is indisputable. Worn maximally indoors as much as you can. And again, obviously keeping your distance as much as you can is the two best weapons, and practically well, not the only weapons, but two best weapons we have right now to combat the spread of the virus.
I've been asked this question even in the last few days. I'm in my office by myself. I'm a faculty member. Obviously, you don't wear a mask if you're in your office and the door's shut and all of that. I mean, you can carry this to the nth degree in regard to that. But Dr. Todd also, and thanks to Dr. Danny Claiborne, their operation, the Institute of Engineering, is process face shields, and the provost may want to speak to that, especially for our faculty members and staff if they would like them.
Absolutely. Thanks to Dr. Claiborne and Dr. Otway and a couple of student workers through the summer. We do have an inventory of face shields. So though that communication is going out to deans and chairs and whatnot, we've also got, thanks to Beth Ward in procurement, I'm going to hold this up for those of you that can see me. This is actually a clear, how does this work again? Here we go. Yeah, like this, a clear mask that that has the cords around it to get it tight. And Beth has ordered about 700 of these. So back to the point on a student that might be hearing impaired or whatnot, these, I think faculty that are on the call, you'll really like this particular mask. It's light and it's clear, obviously, but I think it's going to be quite effective in addition to shields and regular masks. So we're doing our best to have that inventory ready, and it's the shields are ready, and I think I need to check with Beth tomorrow. I think at least half of these are already here.
The second shipment came today, so they'll be headed your way tomorrow.
Dr. Todd, that's impressive. I've not seen that mask. I know I know we had talked about that, and we had some back when I was in training for the people that were impaired that were basically reading lips, but that is really nice.
It is, but all credit goes to Beth Ward on that. I'm glad she identified it, and she asked Haley here in my office to come over a couple of 3 Fridays ago, and we just made the call right there in her office to order a couple of boxes. So thanks, Beth.
That's impressive.
Dr. Jackson, did you want me to play the Dr. Stack video or continue on?
It will not hurt any of us to watch it again.
Great. If you will bear with me 1 second here, I will share my screen. And then we will play this video. We can all see that, yes?
Welcome back to school. Many of my favorite memories and experiences are directly tied to my college years. I really hope you have as wonderful a time as I did, and that you'll look back on these years with similar fondness. Let's get straight to it. 2020 has been a mess, and COVID-19 is going to change your entire academic year. How much it changes, though, is largely up to you. To keep the schools open, to keep students, teachers, friends, and family safe, we all have to do a few things. 1, wear a mask. 2, socially distance. 3, wash your hands. And 4, stay home if sick and get tested. About the masks. Wearing a mask is the single most important step you can take whenever you are near other people. If everyone wears a mask, schools stay open and people stay healthy. If people don't wear masks, if they crowd into bars and party like normal, COVID-19 will run rampant, schools will close, people get hurt, and 2020 gets even worse. In a world full of problems we feel powerless to improve, this is one problem every one of us can improve. Please wear a mask and have a great time at school this year.
Jen, thank you. So students that are watching, help us help you. help us have a good semester. Wear a mask, please.
Okay. Another question, will normal or standard protocols be in place as far as if a student were to have to miss class for being ill, or if a faculty member were to have to miss class for being ill, as far as that attendance, or will there be any type of leeway for someone that might not be able to make it into their instruction or their class for that day? What are those protocols?
Provost Todd, do you want to answer that, please?
Yes, sir. Yes, sir. It's a good question. And yes is the answer to that question. The key word for this fall semester is going to be flexibility. I think all of us understand that. From a student perspective, students that are on the Zoom call here, I encourage you, like we have been all summer, to just stay in close contact with your faculty members and with your advisors. If a situation occurs that the student needs some assistance, whatever that assistance is, again, back to what the president said and Dr. Hughes, make good choices. Stay in close contact with, again, your faculty that are teaching your courses and instructing you in laboratories. For faculty, please stay in contact with your chairs and with the deans. And if something happens in that situation, then we're all part of the Murray State team, and we're all part of the Murray State family. So we're going to get through this, but we have to keep communication open, and we have to keep communication open. I'm a communication professor, so I try to keep that going.
Provost Todd, can you talk to the class formats, and students should be finding out what those class formats are as they get their schedules? Is that correct? And should they know that by now? And if they don't, how will they then need to find out that information?
Yeah, Jen, that's another good question. And yes, that communication is ongoing. Dr. Robertson referred to, and the president did, the new syllabus language. There's about 2.5 pages of additional language that was sent to all faculty last week, I believe. And the request, along with that, to add to their syllabi, I had a personal request to the faculty to go ahead and get their syllabi ready and to communicate that, send the syllabi, if you will, to their students via the Canvas email list that all faculty have access to. And in addition to that, to go ahead and just send an interpersonal communication message, telling the students we're wanting you to come back, we miss you, and this is how the structure of the class will work. In addition to that, students can actually access the answer to that question when they go online to look at their schedule under the building column, which would say either Zoom, or it would say a different building or main campus. So there's a couple of different ways to work that out. All that communication, particularly the interpersonal communication from faculty, that is ongoing. Many faculty have done that. I'm sure there are some that are still tweaking their syllabi and getting it ready, but all of that is rolling, and it has been over the last few days.
One thing I'd like to say, especially the students that are on this call, and all of our faculty members, this summer, the provost office, the deans, the chairs, all of our faculty members, I want to thank you. We have an excellent mix in regard to face-to-face, and hybrid, some type of pure hybrid or Zoom course and online. So there's a very good mix, better than most of our peer institutions. And this is going to serve Murray State well. It's going to serve our students well. And I just want to thank everyone for their hard work in all of these areas to make this happen. We're here for this. Let me back up and say this. This is challenging for everyone. And none of us asked to be where we are right now. And we've got to do the best we possibly can in this unruly environment we find ourselves in. And it's taken everybody working together in regard to making this happen. And I really appreciate the course delivery process and how everyone has handled that, and especially starting with Provost Todd and going down from the provost office to each faculty member of this institution. And because it's important to our students, and we are going to move forward. We're going to do the best we can, and it's not going to be the easiest thing any of us have ever done. It will pass, as we've said many times, and we hope that sooner versus later.
Okay. There have been a couple questions that have come through about how the coronavirus can be transferred. Obviously, we know person-to-person contact, but in the news, there has been information that's come out about it being transferred through HVAC systems, those types of scenarios. And I think there probably is some question about that occurring on campus. Is that a viable way for this virus to be transferred? And is there anything that has been done about that on campus if that is the case?
Do you want me to take that one? The first and foremost common way that it's transferred is respiratory. Obviously, the second would be anything that would be, again, getting back to close personal contact, exchange of fluids, drinking out of the same glass, real close contact. Probably another way to get it, which would be, again, much less likely, would be a surface contact. Keep moving on down the list, and somewhere in there, you're probably going to find the chance for it to be through the HVAC. But again, I would think, with mask wearing, social distancing, even though that may put a few viral particles in the air or allow that to go through, the chance of that would be much slimmer. Getting back to the first two, which again is respiratory and close contact, social distancing, and masks. The third one on surfaces, and one of the others can speak to all the measures that's been in place to clean the surfaces. But if you wash your hands frequently, that's where that comes into play on the surface contact, is washing your hands frequently, especially if you rub them along a surface, not picking a particular surface, knowing that the top exposed to UV light's less contaminated than the bottom of a counter or seesaw on the playground, whatever it may be. Again, gets back to hand washing. So I would be more concerned with the more common ways that it could be transmitted and the common ways to prevent it.
Those of you who've been on campus or haven't left campus or have at least been here temporarily have seen a number of hand sanitizing stations being placed. There have been hundreds of them ordered. They're being put up as we speak. They have been for the last few weeks. So you're going to see a lot of hand sanitizing opportunities. So please take advantage of those as well, and encourage our students and our staff and faculty members to do the same thing.
And Dr. Jackson, I will add too that facilities management is also doing a good job working to increase airflow and circulation into each building as well. They've done a very good job with that.
And let me say one other thing too, back to the surfaces, is that, and one of the others can speak to how often the rooms are washed or cleaned and thoroughly cleaned. The health department was quite impressed in our meeting the other day with them about the efforts put forth on that. And then the other thing too is just the common surfaces that, whether it be a keyboard, doorknob, or handrail, that those are going to get a lot of extra attention just throughout the day. And even when I met with the resident directors and the resident assistants, we ask all of them, when they go up a stairwell or anywhere they go, grab a wipe it down, and all of them know to do that. So there's going to be the daily things that are done, then there's going to be things done probably several times an hour throughout the day.
Dr. Hughes, that's a good point. I don't know if Jackie or if Jason's on here want to talk about the protocol in regard to that, but it's a very in-depth protocol in regard to cleaning to make sure we're safe and healthy in that regard as well.
Yeah, I don't know if Jason's on here or not, but I know SSC has developed a special protocol for the situation, and they are cleaning classrooms nightly. Also our buildings, whether it be the public doors, doorknobs, elevator buttons, handrails, public restrooms. Restrooms are getting a do-over twice a day. Classrooms are at night, and public spaces as well as through offices. Obviously, they can't clean individual offices that many of us are in. Those are kind of falling back on each individual, and everybody's being supplied with Lysol wipes or a cleaner of some sort to ensure that gets done. But the protocol's in place to do the best we possibly can in the classroom space and public spaces that we all use.
Jackie, you may speak to often used place elevators or stairwells or those type of things would be cleaned multiple times.
They will, and they will in all of our academic and office buildings, but also in the residence halls. So when we're saying cleaning the buildings and public spaces and public restrooms, that all applies to the residence halls too. We have to remember we've got approximately 2,500 students living in the residence hall. So the cleaning there is up compared to what it has historically been. But elevators, you know, we don't necessarily have maximum number of people that can fit in an elevator because elevators here are all different sizes. So it's important, as we've been saying, wear your mask when you get on an elevator and make sure it's not totally full, but you're on an elevator for such a short period of time. The guidance is that that exposure is very small as long as everyone's wearing a mask and the buttons are cleaned and the rails in the elevator are clean, and all those things are being done by SSC.
There's been a lot of discussion the last couple of days regarding athletics at universities and colleges. Is there any update on Murray State athletics and where that stands as far as the regular seasons taking place?
Right. I mean, everyone watches the news and is following social media in regard to collegiate athletics all across the country. The OVC Board of Presidents meets this week, and so do all the athletic directors, and we'll be providing more guidance in regard to that this week. So obviously it's something we're watching very closely. The Power Five conferences, as they're called, are making decisions this week in regard to their activities, and so we're monitoring all of that very, very closely.
Going back to the airflow, specifically within the residence halls, is there any benefit to students having some type of an air purifier in their dorm room or anything like that to help with that airflow?
I could try to speak to that. I don't think there's any studies with regards to the benefits of doing that, but it gets back to every little thing that you can do that might have some benefit. It certainly wouldn't hurt, but I couldn't give you a definitive recommendation based upon any scientific data that would help in a room, but I couldn't imagine that would hurt either.
And another, a couple of questions here on the mask wearing. Obviously, we know that is a major component of what everyone needs to be doing when they arrive back in campus, both students and faculty and staff. And I know we've spoken to this a couple of times on some of our other forums and town halls that we have had, but speak to the compliance a little bit. Obviously, we're providing students, faculty, and staff with the tools to be able to follow these protocols. Is there any type of compliance or mandates that are going to be enforced if someone is not wearing a mask on campus?
Let me answer it this way. Okay. I would hope that our faculty and staff, that's not an issue, and I know it will not be an issue. We need to wear a mask. It's that simple. For students, it's part of the student code of conduct now. We amended policies this summer to make sure that we can enforce it if necessary. And as I said to the student newspaper a few days ago in an interview, Dr. Hughes and I were interviewed in regard to that question. We were asked a couple of different times, a couple of different ways. We expect the students to wear masks. And I'm asking a personal favor for the good of this institution, for everyone to adhere to that and wear a mask. That's not much to ask in a civilized society to help tamp down this terrible virus that we're dealing with. And the sooner we do this, both nationally, statewide, Murray State, and in our personal lives, the sooner we'll have this behind us. Dr. Fauci, who's probably the chief public health officer of the country, and has been for many, many years. He's 79 years old. He has spent his life's work in this field. He said, if you wear a mask, it will resolve 80% of the issues of transmission. And I'm paraphrasing it. He may have said 80-some%. But as far as, it's not a lot to ask. It's really not. And I would hope that every student, faculty, staff, administrator here will adhere to that simple request. It's a personal favor for the good of Murray State University.
Can I say something to that effect too? I think what you just heard from President Jackson is just a plea, literally from the bottom of people's hearts, to do what's right. And you can give a lot of analogies of sacrifices made throughout, whether it be the history of this country or the world, that were much greater than wearing that mask. But again, this is something so simple that can help so many, and short of an ordinance passed by a city or a law passed by a state or a federal law, you could just educate and plead to the max to people to do the right thing.
Now, Jen, and I would close in regard to that question this way. There are some people who cannot wear them. There's some that will need special accommodations in regard to that. And if that's the case, then they will need to get, the proper handling of that protocol so that we know and they know that they cannot wear a mask. And there's procedures in place for that.
And for faculty within the classrooms, their requirement would be a mask, not a face shield, correct?
Yes.
Okay.
Some will use both. I know that some will use a face shield only. I know that. It's best that you wear a mask. We're doing everything we can to get through this semester. And it's going to take these simple measures to do that. And the quicker and that we adhere to these simple measures, the easier it will be to get through this semester.
Provost Todd, can you give us just a brief update or overview on the new academic calendar that is going into effect for this fall semester and those changes that have taken place?
I can. I'm going to refer to the Racer Restart page, and it's listed right there. So how many people? 312 people can look at that, and it spells it out. So, yeah, and it's 4 o'clock.
Fair enough. Okay, let's talk a little bit about dining real fast. Talk to us about the new and exciting things that are happening on campus. The students are coming back today. They're going to see a lot of new places, new dining options. What are those, and are there any parameters around those as far as things being open and their hours? Because there are some really exciting things happening right now on campus when students are coming back.
Let me speak at a high level, and then I'll ask Vice President Dudley to give the specifics in regard to it. So while I was out on campus this morning visiting with families and students, and Courage Center was buzzing as well. So I went to Starbucks and went through that line, and it was wonderful. And so that's a nice new addition to campus and the Courage Center. Chick-fil-A will be open and operating. There's construction work going on as we speak to the former Thoroughbred room, which is going to get a complete makeover. I say former, it'd still be the Thoroughbred room, the tea room. It's getting a complete makeover, pretty extensive. Jackie will be able to talk about that. Also, just so everyone knows, I don't want to forget this, a major temporary building is going to be constructed beside Winslow, on the north side of Winslow, that will socially distance and accommodate about 150 students, because inside of Winslow Dining Hall, space will be reduced, or capacity will be reduced by about 50%. So that you'll see that building going up very, very quickly this week. And that's to assist our students and faculty and staff, anyone that uses Winslow's Dining Hall. Jackie, you want to give some specifics?
Sure, I can. You mentioned the tea room, and the tea room is probably going to be running just a couple weeks late when school starts because construction. But Steak and Shake will be opening in the tea room, as well as Tres Habaneros, which will be a Mexican location, and a Sub Connection, which will be a sandwich type shop. So those will all open when the facility opens, hopefully around the end of August, if not before. There's also a new feature I think some folks have already started seeing on Facebook, is the new online ordering options through dining. One of them is called Bite, and folks get on, order, use a credit card, or anybody can use their ID card, their meal plans. You can use Flex Dollars and order. And that'll be something that we hope students will use quite a bit to minimize that seating requirement that we've got. Everybody won't be able to fit in all the venues that want to fit in them. So you can order it to go, and that'll be available for faculty and staff too. If you have Flex Dollars, use them. If you haven't, go buy some and put on your new Racer ID card. One of the changes too in dining, it is the ID card, even though it serves many purposes, but it also allows for touch-free checkout at dining. So if you're using your meal plan or using Flex Dollars, you really won't have to pass that ID card to someone else. So the card and the hardware have been designed to allow that to be a touch-free process for the student. They will be able to use their card, but not have to pass it on to someone else. And I think that the building that the president was talking about will add a lot of space, about double our space available in Winslow, because we have to have so much social distancing. And that'll be open for anyone. You do have to go in Winslow and get your food, but folks will be able to go over to that modular building. It'll be just very close to Winslow in the north parking lot. And that'll be available as long as we need it to be there. So a lot of exciting things. Sodexo's working on continuing to offer new options. I think we're working on maybe some different hours, and I don't know what those are exactly off the top of my head, but I do know their dining webpage has a lot of information on it. I'd encourage the students to certainly go there, learn what they can of all the venues. Everything will be open when we come back, except the tea room. It'll be running just a little bit late.
And Dr. Jackson, I believe you tested out the new Starbucks this morning, didn't you?
I did. It was very good.
Perfect. Real quick, let's jump back to the health side of things with flu shots. Will flu shots be offered on campus this fall, and what is the process for that?
Dr. Hughes and Joyce can talk about that, but there's going to be a very laser-like focus in regard to flu shots, and Dr. Hughes can tell you why, and HR can explain when.
I'll go first, and Joyce, if you want, I'll let you talk about maybe logistics. And first off, and this is true of every year, when we get the flu vaccine is always the big unknown. If we order 3,000 or 4,000 doses, let's say here at the office, we may get 200 or 300 show up the 1st of September, and then 2 weeks later, another 1,000 show up, and then 2 weeks go by and we get 100. It's totally up to the distributor as to how they put out the vaccine. But the goal this year is to get as many doses as we think we're going to need and more, and to encourage people to get those at the earliest possible moment. It used to be traditional on flu vaccines that you recommended wait till mid-October so that when February rolled around, you had a good antibody response still present. The vaccines over the years have become customized to where there's a dose for one age bracket and then a much higher dose for the older people in our population to stimulate an immune response. That vaccine should be good for the whole year, no matter when you get it. And we've seen flu come at earlier times, but this year, when the flu vaccine becomes available, get it, whether you get it in your hometown, from your family physician, wherever they may be, even if here in the region, or at a drugstore. The bottom line is just get it as quick. And the reason for doing that is we don't want people to have COVID-19, which is the illness associated with coronavirus, or the flu, or hopefully not both at the same time. And then the second thing too is we don't want to confuse the two illnesses. I mean, it's always going to be confusing to tell what's what, but when you've got similar symptoms in both illnesses and you don't have someone vaccinated, then the index of suspicion for them having the flu versus corona goes up much higher. So it'll make diagnosis easier. It'll improve the health and safety of the individuals to get those as quick as they can. The flu vaccine, as soon as we get it in, will be offered at health services, as it will be offered here at the office. And then I'll let Joyce speak about the potential flu clinics and drive-by flu.
Okay, thank you, Dr. Hughes. We are, Lauren Smee with Racer Wellness has been working with Marky and her staff. What we will have is 2 different flu shot clinics. This was if you've done your COVID-19 mandated training, you saw this information was highlighted in there. We continue to encourage people, but one will be a drive-through. With that one will be a drive-through on the back parking lot of the Wellness Center, and we'll get details out on this once we know exactly what the dates are going to be. The other is going to be a walk-up that will be between Wells Hall and Wilson Hall. We'll have, the big tents, and we'll have everything where everybody will be socially distanced, even those of us who will be assisting health services with doing these. I want to emphasize that we will have, the minute we know when those vaccines are available, then we will do the push. We've got all of the logistics worked out, except the dates and the time. So other than that, we're in good shape, but everything is ready. Just once we have that information from Marky, we are ready to go with that. I would add that for faculty and staff, this is not true for the students, but for the faculty and staff, what Murray State is doing is purchasing these vaccines, and primary care health services are providing those actual clinics. We would encourage you to do it this way instead of going to your physician, if you can at all, because if you go to your physician, it also appears to be free to the employee, but there is a substantial cost to the health insurance plan. So we always offer flu shots available through our health fair, our big health and benefits fair in the fall. 400 plus people in the ballroom is not going to be possible this year. So with Dr. Hughes's help, we're able to do this in some different ways. So we're all having to be very flexible. And then Dr. Robertson, you may want to talk about, just so everybody's aware of, the separate ones for students will be same locations, but working a little bit, they're trying to keep those 2 populations different. Now, let me say one more thing, though. I think this is important. There is, as Dr. Hughes explained, a stronger vaccination for age 65 and older. We have not been able to offer those at our health fair up to this point due to the cost, but these are going to be available for, we've provided how many potentially we have in that. So that this year particularly, that higher risk category, I would encourage, whether you normally do or not. So that will be something that we have available at these fairs as well. Dr. Robertson?
Yes, just quickly, there will also be flu shots available for students. And again, we'll get those dates publicized as soon as the vaccine comes in. There will be two clinics. One will be the drive-in at the same location that a different day, but the same location that Joyce indicated. And then the walk up, right now we're going to have one at one of the residence halls, probably Franklin. And again, we'll make sure students know the date of that. And then, of course, anytime they can go to the health clinic on campus and get the flu shot, as well as go downtown if they prefer, or to go to their own provider. For the students, it will be, you can use your health insurance to pay for that flu shot, or you could pay a fee. You could just pay for it if you don't want to use insurance. And then we know there could be situations where some students don't have the insurance or the ability to pay, and we'll work with those students also, because it is very, very important that everyone takes the flu shot. So we don't want finances to stand in the way of that if that becomes an issue for a student. But still be available for the students also around the same time period, but we're going to have it on different days so that it won't be confusing about where. We won't mix the students and the faculty together since there's a different process.
Okay. We spoke a few minutes ago about a lot of the new dining enhancements that have been happening on campus over the last several months. Are there any other large-scale building improvements or projects that are scheduled for this fall? I know that Fine Arts has recently got a nice little makeover with a lot of pressure washing and painting. Are there any other things happening like that are improving the beautiful look of our campus?
Actually, there are several. This summer, we went through really all the projects going on campus or had been planned to go on campus. And we slowed many of those down and stopped some. The Price Doyle Fine Arts Building has been power washed and is process of being painted. It will be done very soon. We thought every 32 years we should paint that building, so we're painting it as we speak. I think, Jackie, it was 32 years. Someone told me that, but it looks a whole lot better, and you know, we need to take care of the assets that we are charged with. There's work going on in the biology building. There's work going on in Blackburn. There's work going on in regard to John W. Carr Hall now, former Carr Health Building, and there will be work in front of that building for that plaza area that's occurring, and also there will be work going on in front of the Curris Center. So there will be a nice addition in front of the Curris Center in the months to come. It will be Racer One, a bronze statue. It was privately paid for. It's about 150% of life size, and it was an artist completed it a few months ago. It's been worked on for about a year, and there will be also a statue, seated bronzing of Dr. Carr, the first president of this university, that will be put in front of Carr Hall that was privately paid for. So there's a lot going on to make sure campus looks like it should, and also a lot of asset preservation and deferred maintenance work going on campus as well. Jackie, I don't know if you want to add to that or not, but there's a lot occurring, so pardon the dust and activity.
Yeah, I think you listed most of the larger projects. I'd add that the 15th or 16th and Ryan parking lot, actually for those folks that work on that side of campus, has been surfaced. That was one of our gravel lots, and Facilities was able to get that surfaced very recently before the start of school. So that's an improvement over there that I think everybody that works on that side of campus will appreciate.
I know that we probably have a lot of students on this call today. Dr. Robertson, I'm going to put you on the spot for a second and see if you could talk a little bit about the family weekend and the new virtual family weekend that will be happening in early mid-September.
Yes, I think the date is September the 11th. And again, there was been a committee working on that all summer. So it's going to be primarily, there's going to be a number of programs and activities going on. The majority of those will be virtually done. There may be some smaller in-person activities also. But the opportunity to come back and visit the campus for parents and family members will still be there. But it'll be more smaller programs, smaller gatherings, many of which will be virtual, but there's a full schedule of activities that is on the website. You can go to the Family Weekend homepage and you'll see all the activities and the schedule. Information has also been sent out in our parents newsletter that provides the schedule also.
The University Bookstore, that is currently open. People can visit that now that campus is back open. Is that correct? And what are those hours? Do we know those hours off the top of our head? Sorry, Jackie, I know I just put you on the spot.
Actually, I was in the bookstore this morning. It's open. There's a lot of cool, neat new stuff in there, but I can't tell you the hours.
I can't tell. We did not change them. But I will point out, I want to make sure everybody knows, and the students that's on the line, the prepackaged pickup for books is being managed on the first floor of the Curris Center this year. It's kind of where we had the Racer One Stop across from Chick-fil-A. That's a little different location. So that's also to help with social distancing, and they have markers for lines to go out that area, but make sure students go to that area to pick up their books if they ordered prepackaged books.
And university hours, 8 o'clock to 5:30 p.m., I believe is the accurate time there. And Jackie, you mentioned Racer One Stop. Since we do have students on here, that is taking on a little bit enhanced look and feel this year. Not only do we have some in-person options for students, but we have virtual options and then a self-service kind of 24/7 offering as well online. Can we talk a little bit about the One Stop and what those offerings are for students that may want to explore that a little bit more?
Yeah, we can. As you said, there's three options, and this is our first year to kind of go down that path. Previously, the Racer One Stop has been an in-person event for us, but everyone has pulled together and created a self-service type option that's got lots of small videos and self-help type options that individuals can go to, and it will answer many questions. I think if they just go take the time to go there, would not have to come in person. There is also a virtual One Stop. The information on the virtual One Stop is actually, we have a web page called Racer One Stop. And if you go to Quick Links, it's actually the second link there. And you will see the times for the virtual One Stop. And you will also see the times for the in-person One Stop. In person is the same place it was last year. It's up in the small ballroom in the Curris Center. And they actually are there 10 to 2 this week, and will be there through the 21st of August. So make sure you look at those times. They are a reduced time frame. Face-to-face One Stop is a pretty intense process. So we're trying to get students there that need to see people face-to-face. They don't, we encourage anyone that needs to contact, whether it's the registrar or student financial services, really to go that virtual Racer One Stop and try to get assistance. So first time, we'd like everybody's feedback on how that works. And Dr. Robertson may have some things to add with that, because I know quite a few of his areas involved in that too.
I think you've covered it very well, Jackie. Virtually any question or any service you would need, from academic advising to checking on scholarships, financial aid, your bill, veteran services, whatever the case may be, a student can have that taken care of by just going on to the One Stop virtually or going in person and getting all your questions answered in one place.
And registration is also available there, correct? Should someone
Yes.
want to? register for classes.
If there's registration, and if someone still hasn't decided where they want to go to school, they can actually come there and we'll admit them to Murray State also.
Perfect. One last health-related question, Dr. Hughes, I'll let you field this if you'd like to. Are we offering virtual appointments as well through health services?
Yes,
Both here on campus and at primary care?
yeah, optimally, it would be a virtual visit. The government has relaxed about all the regulations around that during the COVID crisis to try to limit contacts. But yes, it could be if someone called student health and they wanted to do a virtual visit, then they could be teed up just as if, you know, they were there in the exam room with either me or the nurse practitioner that's in that facility. Now, not all things can be done virtually, for instance, abdominal pain. And if you're worried about somebody having appendicitis, but the virtual visit will be where you basically triage that visit into someone that needs to be seen in person, or you can take care of it over the internet or over the phone or whatever connection you have with that given individual. So yeah, I would encourage the virtual visit, and for the student or the faculty member or anybody that's busy, that's a lot more convenient. I wouldn't advocate driving down the road doing it, but I've had several people I can tell driving down the road doing it. And trust me, they saved a lot of time. They can pull off the road would be a better idea and do that. But you can do a lot virtually. There are just some things you have to see the person in person. But yeah, the first entry point would be good to go virtual. So I think the students would like that too, because it'd be real convenient for them, and they could do it from anywhere. I've actually had some of the students this summer that, let's say maybe in Memphis, or pick any city you want, they went home for the summer, but they still have their connectivity to Murray, and they call for a visit. And there used to be an interstate prohibition against virtual visits, but during this COVID crisis, all that has been dropped.
Well, Dr. Jackson, we're nearing our 4:30 time frame here. So if I could turn it back over to you, and then maybe we can just touch on reiterating about the questionnaire and the checklist that students, faculty, and staff should fill out before returning to campus, and then any closing remarks you might have.
Jen, thanks. And thanks for moderating. And I know we did not answer all the questions, I'm sure. I don't know how many are left, but we will. So if you ask a question and it wasn't answered, we'll get to it. But most of all, I want to thank everyone on here and many others who are not on here in this meeting today, this town hall forum, in regard to the work of the last many months. Again, this has been tough, and it's been tough on a lot of people. Whether you're faculty, whether you're staff, whether you're administrator, there's a lot of hours and time that have been put into this. So, you know, paramount to all this is the health and safety and well-being of this campus. If you think of a question later, ask, and you'll get an answer. So don't hesitate to wonder or let rumors fly, or whatever the case may be. Ask, and we'll make sure that they get responded to. Read the RACER Restart Plan. Okay? Read the RACER Restart Plan, please. And that website is full of information intentionally for students and faculty and staff and administrators. If you forget something, go back, direct people there if they have questions. Again, there's a searchable function, there's videos, there's a Q&A section, there's a 25-page PDF that you can print off if you'd like and go through it. There's questions about contact tracing and testing and quarantine and anything you can think of in regard to that. If you haven't completed on MyGate the Return to Campus questionnaire, please do. That needs to be done ASAP. Please, it takes 3 minutes. Please take the time to do that in the next 24 hours. You know, this is a unique part of our history of the world, this country, and this institution. And we will be defined by it. This institution will be defined by it, and all of us will be defined by how we respond and how this semester goes. And we're all going to do the best we possibly can to make it the best possible semester that we can. And I know everyone's going to work very hard in regard to that. And, you know, especially to our students, you know, we owe you that to make sure that it's the best possible semester in this unruly environment that we can provide. And so let's all work together to make that happen. I appreciate each and every one of you. Again, if you have additional questions later, just send them in to Jordan go to the Racer Restart website again, and you can submit questions. You can submit to your supervisor, your chair, your dean, or whomever, and we'll make sure you get your questions answered. I appreciate it, and we'll see you in a few days, and we'll go from there.